Welcome home, everyone. It is Wednesday, April 1st, which is April Fool's Day. But we all know that what we're facing right now is no laughing matter at all. It's kind of hard to believe that in seemingly the blink of an eye, our lives changed so dramatically. I mean, I just want you to just remember this stat that about a third of the world's population is living under some sort of coronavirus related restrictions. A third of the world is being restricted in movement. I mean, it's kind of hard. It's hard to fathom. I'm coming to you from LA, which, as you may know, is under lockdown orders. Those orders were put in place on March 19th. So I'm approaching 2 weeks of being locked in. And the truth is, there's no end in sight. That's basically the truth. But I know we're going to get through this. I, like so many other people, firmly believe that the answer here, or certainly one of the keys here, is caring about your neighbors, be they near or far, be they loved ones or strangers. That one of the keys here is to rebuilding in some places and strengthening in others community. And really at the heart of the show is community and compassion. Those are our core principles with this show. And community is what drives many of the guests that are joining me today at home. In the case of one of them, a healthcare provider who's going to be speaking to us from Accra, Ghana, that city, that capital city, is itself under a lockdown. He's going to be talking to us about what it is like to be working in the healthcare sector at this point in time, what he is seeing, what he's hearing. I mean, is he concerned for his own safety? I mean, certainly here in the United States, you hear that repeatedly from doctors and nurses. They are afraid, understandably so. They have lives, they have loved ones, and this is a highly contagious virus. So we're going to be speaking to someone from Ghana about that. Another person that we're going to be shining a light on is an activist, a woman who spent a lot of her life focused on the issue of communities, specifically poor communities, communities of women in Burkina Faso and sub-Saharan Africa. Her focus is the issue of water, access to clean water and hygiene. So I'm so pleased that Georgie Bardiel will be with us to talk to us about that and what she's doing in this time as she looks at innovative ways to connect with community. And then, as always, on Home with Isha Sesay, we always try to end with the bright side of things, because we believe you've got to hold on to hope. You've got to be seeking inspiration and positivity in this time. And today's bright side comes with a dose of humor, a side helping of Congo swag, and Eddie K will be on the show to tell us how he's dealing with it and how he's still finding laughter and joy in these dark times. So lots to get through. I've got a full table for you. Let's dig in. All right. Let's start in Nigeria, of course, Africa's most populous nation, and a country which, as you may recall, has the states of Lagos, neighboring Lagos, and the Federal Capital Territory of Abuja, all under a lockdown. Tens of millions of people in Nigeria facing restricted movement. That order went into effect this past Monday. To bring you the latest numbers as reported by Johns Hopkins University, which has its own resource center that is tracking the numbers of coronavirus cases worldwide. They place Nigeria's cases, confirmed cases, at 151 with 2 deaths. Let's get the very latest now from Lagos. Journalist Simon Kolawole joins me now. He's also the founder of Cable Newspaper Limited. Simon, welcome. Can you hear me?
Yeah, I can hear you.
Okay, thank you so much for making time to stop by the show.
Yeah.
Let me ask you this: you're joining us from Lagos, which, as I just told our viewers, is under lockdown. According to John
Yeah.
Hopkins, they placed the number of cases at 151. It's been reported that there's 16 new cases confirmed today. In light of these growing numbers, have any new measures been announced by the government?
Well, as you are very much aware, we are currently under a lockdown, which started on Monday night. Um, Part of what the government is trying to do now is to what they call contact tracing. Nigerians travel a lot, and
Yeah.
most of these cases were imported into the country. Most of the cases. So there have been secondary contacts who have also tested positive, but a lot of people have disappeared into thin air. We are trying to trace about 6,000 possible contacts now. So part of the reason for the lockdown is to see how to slow down the spread of the disease, so that during this lockdown, those who might exhibit symptoms will be able to come forward for treatment. So what the contact tracing is a major thing the government is doing now, in addition to locking down the city for 14 days.
So I want to be clear. You gave a number, and it's an extraordinary number. So I'm just going to ask you to repeat that. You said there's 6,000 possible contacts, and
Yes,
a large. I don't know whether it's a large number, but certainly some proportion of this number have disappeared. How robust
yes.
is Nigeria's contact tracing system?
Well, the government officials complained recently that people were lying with their data, because if you were on a flight coming to Nigeria, you were normally given a form to fill. Where are you coming from? How many countries have you visited in the last 1 week? Then give us your home contact and your phone number. So many of them lied in filling the phone numbers and the home contact. So, but there is a way the government can track it using some extraordinary measures. Uh, Currently, according to the commissioner in Lagos State, they were able to trace up to 70% of those contacts, those who disappeared into thin air, as it were. They've been able to
Okay,
trace them, about
so
70%.
70% of the 6,000 possible contacts have been
Yes,
traced.
yes,
Um, okay, you said that there's some measures to be used to
yes,
I guess deal with this incorrect, false data. Can you tell
yes.
us about those measures? Tell us more. What do you know?
I understand that the government has some powers, for instance, to get the data from the airlines. When people are booking flights, they certainly put in their addresses and phone numbers and emails and all that. So I'm sure the government may be exploring that option. Under the current
Okay,
emergency we have, they have such powers.
they have such powers.
Yeah,
Obviously, if you're in a situation where you had 6,000 possible contacts,
yeah,
70% may have been traced, but 30% is still a significant number for a disease that is highly contagious. The obvious next
yeah.
question is how widespread is testing?
Well, we've not been very good at testing until recently. As of 2 weeks ago, we had done less than 200 tests. But
So
now
you
we
said
are doing
200 tests.
yeah, as of 2 weeks ago, yeah. But we received some consignment from Jack Ma, who brought in 20,000 kits into Nigeria. And we're also receiving more from different sources. So we have ramped up testing now. The Director General of the Nigeria Center for Disease Control told us that we'll be able to do 1,000 tests a day in the next few weeks. So far, we have done 2,000 tests,
Okay,
according to
and
the
very
Minister
quickly,
of Health.
so you said 2,000 tests since,
According to the
well,
Minister of Health.
according to the Minister of Health. I'm
Yeah,
wondering very quickly, because we're almost out of time, whether
yeah,
the Minister of Health is saying anything about, and it's hard to say this when you don't have a full picture because you're kind of moving blindly in some ways if you're not testing
yeah.
widely. But what is the modeling saying about when this might peak?
Well, there is no national model yet, but in Lagos State, where I live, the commissioner addressed the press last week, I believe, and said we are looking at a worst case scenario 39,000 infections in the state at the peak, a possible
Okay.
39,000 infections. But the good news for Nigeria is that a lot of those symptoms are mild to moderate. Uh, most of the patients are doing very well, just that they are taking extra measures to be sure they're no longer secreting the virus in their cells. So that's why a lot of them are staying a little longer in treatments at treatment isolation centers.
Yeah. Simon Kolawole, we appreciate you joining us and giving us that view from the ground.
Yeah.
And obviously the hope is that everywhere really that is battling this, that we can see capacity for testing increased rapidly. Simon Kolawole joining us there from Lagos. Thank you. Please be safe. All right. So I want to bring you just a recap of what stood out for me from that conversation or with Simon rather, that though they have these 151 confirmed cases, 60 new confirmed cases today, that's according to John Hopkins, that the country now is dealing with this batch of people, if you will, who have disappeared into thin air, to use Simon's language, that there have been 6,000 possible contacts, right, from these 151, and that 70% of them have been traced, but that still leaves 30% that have disappeared. Simon makes the point about data. We fill these forms in when we're on planes, give data, give information about where you're staying, what's the contact telephone number. That information is important. And, often when I'm on a plane, I really am very offhand about it. But these moments make you realize why that information needs to be correct. Because if something happens and they need to contact you and you've given erroneous data, what happens then? Simon makes a point that they are using other measures to try and track this 30% of that 6,000 who are missing. Again, significantly, more than half have been traced, 70%, but 30% for a disease that is highly contagious is still worrisome. They are looking at expanding capacity, but as of 2 weeks ago, less than 200 tests had been done. We're going to continue to follow very closely the situation there in Nigeria, because it's absolutely critical that we do. Lagos State, still trying to paint a full picture beyond Lagos, or the whole country, of when this might peak and what those numbers might look like. According to Simon, and he confirmed something for Sayo, so Yombo, a different journalist we spoke to a few days ago, said that Lagos state authorities were saying that modeling for Lagos showed that worst case scenarios for a peak of cases in Lagos would be around 39,000. The thing about projections, the thing about models, is that they can change. So, this is not something that anyone can rest easy with or say, oh, it's just 39,000 in a state that has something like, 21 million people. Anything can change very, very quickly, because this is a highly, highly contagious disease. But that is what the modeling says. So that is a possibility that the height of it could be 39,000. So we're going to continue to watch the situation in Nigeria very, very closely for you and bring you details of that. As always, your comments are absolutely key. That's why we do the show, because as I said, it's about community. So, it's important that you write in. I want to hear your thoughts, your further questions, any comments you have. You can send them directly to me on Instagram. My handle, I am Isha Sesay. I'll say that again as I stuttered on my own name. I am Isha Sesay. You can also send it via Twitter if you wish. I am Isha Sesay there as well, making it easy for you. But send in those thoughts and comments, because, it's absolutely important that your voice is heard, and we want to share that with the world. All right, moving on from the situation in Nigeria. At a time like this, where we feel like we're inundated with new problems and the old ones still exist, the need for a new way of looking at things is more important than ever. An enduring problem, as many of you know, is this issue of access to clean water and hygiene in many parts of the world. And in Africa, it is definitely one that we contend with in several areas. One woman has made this issue her focus, particularly in her home country of Burkina Faso and in sub-Saharan areas that are close by. But right now, as we battle this coronavirus crisis, she is working to do much, much more. I'm so pleased we can bring in Georgie Bardiel Liberty. She's the CEO of the Georgie Bardiel Foundation. She's not in Burkina Faso. She joins us from the Gulf Shores of Alabama. Georgie, can you hear me?
Hi, I can hear you. Can you hear me?
I can, loud and clear. Thank you for taking the time to speak to me.
No, thank you so much for having me in your show, Aisha. I'm very grateful to be a part of this show. Thank you so much for what you do for the community, and thank you.
No, thank you. I'm grateful to you. Listen, you're speaking to me from Alabama, but I want to be very clear because you're very upfront about this, that your heart, your thoughts are very much, in Burkina Faso right now. You're looking very closely, you're watching very closely the situation. I want to bring our viewers up to speed that according to Johns Hopkins right now, Burkina Faso has 261 confirmed cases, 15 new cases confirmed today, 14 deaths. I've got to ask you, you're speaking to friends, family, government authorities. I mean, what are things like in the country right now?
Yeah, right now, actually, the last update that I have from my team in Burkina Faso, we are at 282 affected
Wow.
people. We unfortunately lost 16 people, and thankfully, we have 46 people that we healed from COVID-19. And right now, our biggest challenge is, Burkina Faso is one of the poorest country in Africa, and people live day by day. Right now, mothers are being trying to sell their goods in the market so that they can feed their families. And the police has been going there and disturb them, taking the goods from them. And I am kind of like, I don't know if self quarantine will work in Africa if a government does not provide the basic need for the people, such as clean water and food security. I don't know if that would work. And myself, my mother used to sell goods in the market and to feed us. So I can imagine how these women are going through. Is crazy, is insane. And so far, what the Georgie Bardiel Foundation has been doing, we partner with the government, the Ministry of Health, to start a campaign of awareness on the street of Ouagadougou and in rural places where we worked. There is places where my team get, and they kind of like we're telling them there is a new virus out there. They should be careful. They should wash their hands with soap, and they're like, "Whoa, we don't know that there's a virus out there."
Really?
Yeah,
There's still areas of, the capital where people don't know about coronavirus
not in the capital, in the rural places.
in the rural
In
places.
the villages, they don't know, they don't have access to information, they don't have radios, they don't have TV. So basically they're like, well, we don't know, thank you for letting us know. You telling us to wash our hands, we don't have access to clean water. You telling
So
us
what happened? Yeah.
you
And you say that, and I just want to jump in right there. So what happens then?
Well, right now we're working very hardly because today the big question that we have been asking to ourselves is, are we going to stop building wells because of COVID-19? We have to continue the work we are doing, because if we have to stop building wells, bringing clean drinking water to the people that are in need because of COVID-19 is going to be a disaster. So far in Burkina Faso, about 14 million people don't have access to proper sanitation to wash. 14 million out of a population of 20,000 people, 20 million
20
people.
million. Yeah.
It's, to me, it's just insane, and GBF right now is trying to bring, we want people to become self-sufficient. So right now we're working to provide to create small garden for about 70,000 people for 2,950 families. Because people will have to grow their own food.
But what are the realities of being able to? What are the realities of being able to continue this work when you are facing a disease like this, which is highly contagious, and authorities are calling for people to not be close together, digging wells, starting small gardens? I mean, how do you operate in this kind of reality?
Mm-hmm. So far, right now, what we have been doing a lot of campaigns of awareness, because people have to change their habits. Africans, we love to hug, we love to touch. I would say even all human beings, that is what we all love, right? So now we need to change people's habits. That's why we are going to create 2,950 family gardens, basically for 70,000 people. And that will require a lot of funds. So we need help. However, anyone can help. You can donate $5, $20. We already have an organization that is covering up staff. So 100% of anything we receive will go to the people. And right now we're trying to protect our health worker people, because they don't, like, look in New York, in California, they don't have the basic. They don't have maxis, they don't have a doctor outfit, and a lot of other things. So I'm kind of like, if we don't protect, we don't have a lot of health worker people. So if we don't protect them right now, when it's going to really hit Africa, what is going to be? So I think we should act now. We should. It's very important, and we don't have to wait. Right now, Burkina Faso is the most affected country in West Africa with COVID-19.
And when you say so clearly what needs to be done, and I hear you and I agree with you, and I come from Sierra Leone, also one of the poorest countries in Africa. So, these challenges that you're speaking of are very real to me and are very well understood. You lay out such a clear plan of some of the things that are needed, the wells, the gardens, because people need to start growing food. When you speak to government officials, because you have access, you have a voice, what do they say to you?
Burkina Faso was suffering of terrorist attack before. So a lot of the funds that the government was receiving, or the government have, they were using that money to fight already terrorist attack. So now with COVID-19, they are lost. I'm sorry, I have to be real.
No, this show is all about being real.
They need. And when I say they need help right now, the best way to help is philanthropy, yes, the government. What we do is we work directly with the communities. So investment needs to be made on philanthropy, so these people can invest directly in communities. I mean, it's good to give the money to the government, but I don't know if that money will get there, because they have so many problems. So I'm going to be real.
Now 282, as I went to add, the number was 261, but it has gone up. The country now facing 16 deaths. Burkina Faso, incredibly poor country there in Africa, like my own country of Sierra Leone. So let nobody say that I'm trying to shade Burkina Faso. I'm just, this is a time for us to be direct and for us to be clear-eyed and to say what our situations are. And she makes the point that, she worries about seeing something like a quarantine put in place in her country without sufficient help being given to the poor and the vulnerable, because poverty is an issue, food security is an issue, access to clean water is an issue. She runs the Georgie Bardiel Foundation, and the work she's doing is to scale up access to clean water and to spread information that's critical at a time like this. She made the point that in rural areas of Burkina Faso, people still aren't really in the know about the coronavirus, and people are grateful for these information campaigns that people like herself and other organizations are doing right now. We need to get the word out, and we also need to find a way where we can put the measures in place to keep people safe, but also support them through these difficult times. We've heard that over and over again. Officials in in DRC have said things like, certainly in the city of Goma in the east, when we spoke to Thomas Naibo, you may remember he said authorities there saying if you try to quarantine folks there, they would starve or they would riot. So these are the realities in Africa. It's not a one size fits all. We can't just take what we're seeing in the West and put it on Africa and just say, it's the same solution. We have to kind of contextualize it for our specific conditions. And one of the major conditions we have to deal with is the issue of food security, access to clean water in certain places, sanitation limitations in certain places. And we have to make some kind of provision for people, for them to be able to do better, to be able to look after themselves while we have these restrictive measures in place. That's just absolutely critical. Let me see if you've sent some comments. Let me see if I can get some up, because I would love to share what you're saying. Let me see where we are with that. Some comments coming in. And thank you to everyone who's taken the time to write. Let me share some of this. This is from Special Alsat. How can African government not follow proper protocols to make things work? Listen, I think, thank you for writing in. I think, these are tough times, and African governments, like governments all around the world, are trying to find a way through this. But there are certain protocols that the WHO has put in place with regarding to testing, with regarding to spreading the word about social distancing, and that stuff from the experts has to be put in place by our governments. That is absolutely crucial. We have to listen to the experts. This from Temi Fums. Love the honesty. Philanthropy is very critical in most African countries now more than ever. Most countries were already dealing with several issues. So true. Dealing with many issues. So at a time like this, communities in need in Africa, around the world, because I think we always have to, we're talking about Africa, but I also want to make it, I want to put that context on things that, people around the world need help. It's not just us in Africa, right? We do need the help. And wherever you are, if your heart is in Africa, if you can support Africa, please do. And if you choose to help other people in other parts of the world, if that's where your focus is, do that too. This is a time for community, global community. Maximonova one, this is a new world, new era, a new deluge, a different world order to change the way we were. A lot of people are talking about this, that this moment is going to reshape where we're at. That's going to reshape the way we live, the way we interacted, and what we took as our priorities. And I certainly hope so. I certainly hope that's the case. Chubb Brown, hey y'all. Hey Chubb Brown. Thank you for writing in. Thank you for staying with us. Really appreciate it. Thank you for your time. Thank you to all of you who, wherever you are in the world, that you've chosen to spend time with me on this Wednesday. I am Paul David saying blessings to you too. Every day with Len, a new age of government leaders in Africa is needed. And thank you to my namesake. Got to give a shout out to my namesake, Isha Sesay. There are many of us floating through the world. She says, hi, my name is Isha Sesay too, and I'm from Sierra Leone as well. I love you. Sending love to you as well. Good name, by the way. Good name. All right, let's get back to the show. Thank you. Your comments, your thoughts, your feedback is critical. This is a dialogue, so please keep writing, and I'm going to keep reading, and we're going to keep this conversation going. I want to keep going and bring you more news from the continent. The situation in Ghana is one also that we're following closely, like the entire continent. We're doing it all here at home with Isha Sesay. Excuse me, all 54 countries. I keep joking because I ate cheese just before the show started. Everybody knows you should not eat cheese if you use your voice to speak, to broadcast or sing. So forgive me if I keep clearing my throat. That would be the cheese sandwich. Moving on, the situation in Ghana is one where you will recall that the President Nana Akufo-Addo put in place stay-at-home orders for Greater Accra, Kumasi, and Tema. Those went into place early this week on Monday, I believe. Again, tens of millions of people affected, a situation that we continue to watch very, very closely. The last numbers that I saw for Ghana, let me pull them up for you, because let's see what John Hopkins is saying for Ghana. The last numbers I saw were 195 cases. Let's see if that's still the case, because they are doing a real-time tracker. So if you want to follow along the numbers from anywhere in the world, go to John Hopkins, the University Resource Center, and the numbers that they're giving for Ghana have not changed. Because I want to make sure it's still at 195 is what they are saying there. 195, but there can be a lag. 34 new cases confirmed today. Let's get the view from the front line, if you will, from a medical provider, a medical practitioner. I want to go now to Accra and bring in Dr. Tamakloe. Doctor, can you hear me? Eliken, can you hear me? Hi, how are you?
I'm good, thank you. And thanks for having me.
You're so welcome. Thank you for joining us. First of all, let me ask you, those numbers that I just gave for Ghana that I just read off the John Hopkins Resource Center site, say it's at 195 cases in Ghana. Is that still the case?
Officially, yeah. But then I think the reality is that it's a lag between the test and the results. And also for those who are not being tested, I think we are working with a higher number because of what we see in the hospital.
Okay, so tell me, what are you seeing in the hospitals?
So I manage, my background is emergency medicine, but I'm currently managing a hospital in Ghana, which was just ideally located close to the airport. So that area is is a hot zone. So we actually started seeing a lot more patients coming in with these symptoms, and we picked up a number of cases which were confirmed. Increasingly every day, we start to see those numbers of suspected cases increasing. And that's what gives us the indication that actually that rate of expansion is really going up every day. And so even today, we actually tested about 20 people. And I think that compared to a few days ago, that was about 10 people. So as a single entity, if we extrapolate that, you can imagine that these numbers are actually probably larger than we're anticipating.
Yeah. And you're talking about your ability to test where you are. Can you give me an overview of the country's ability to test, what capacity is like?
So, I mean, there is one lab in Accra, which is a WHO certified lab, and another in Kumasi. Now, the challenge is not so much the lab, it's really around the test kits and the ability to actually take the samples. And the restriction there is obviously personal protective equipment for the frontline health care workers. There is really a shortage. So you have a number of variables that are preventing people from being tested. And actually, the government just ordered new test kits because they run out for a period of time. So these are challenges that affect getting the sample to the lab and then getting the result to the community.
One of the things that I want to ask about, because, we spend a lot of the time talking about, big cities, big urban areas. But we know that the urban rural spread in a country like Ghana, my home country of Sierra Leone, on the continent is real. I guess my question has to be, how much do we know about the spread of the disease in these rural areas, or is that a blind spot, say, in Ghana?
I think as other people have spoken, I'm sure that the biggest challenge is data. and verifiable data. So, I mean, all the data we have is arguable. So we know that in the daytime, there's about double the number of people in the city versus the nighttime. And it just
Mhm.
shows the spread. So about 4 million people in the day in Accra, about 2 million people at nighttime. It just shows the movement of people going out of the city and coming in. But then there's no way of tracking that. And I think
Yeah.
there are opportunities. I think this is where the opportunity to start using technology and GPS tracking, these are all opportunities. And a lot of the tech community is starting to really see how they can play a part of that solution. I don't think there are any concrete solutions just yet, but that's the opportunity to kind of quickly move to address the issue.
Yeah, no, I couldn't agree more. Um, I want to ask you about how it feels to be a healthcare provider at this moment in time. For you personally, you're managing a hospital. I don't know your level of kind of face-to-face interaction with people, but you're in a hospital setting and people are coming and going, and that includes sick people. Are you scared?
So, the reality is that all doctors, nurses, orderlies, security men are human beings, and fear is part of our nature. The reality is, everyone is very anxious. I walk around. Today, I was walking around in every department, just to try and make sure that I could be there, at least to let people know that they're not alone. And I think that's the reality, that it will take a lot of partnership to really get through this, because it's challenging. When you heard about the statistics of the numbers, I actually think the numbers in Africa are underestimated.
Hmm. I
I think that
agree.
we'll never know, because there won't be enough testing to confirm that. But what I think everyone is saying is, what happens if I come to work and I pick this up? And so, yeah, I mean, for me personally, I think it's been on my mind. A lot of the things I'm doing is really working with the ministry to really look at how do we start to. I mean, I work in the private sector, and this is even more so a challenge, that the private sector are businesses as well. And so, if they can't continue working in terms of paying their staff, then not only do they have a challenge of treating patients, but they have a challenge of survival. And
Mm.
so I think this is the time that the private public sector have to work together. Private sector can move faster, and I think that the private sector fits a small gap, but it's really challenging if you don't know where your next paycheck is coming from.
I
So
agree.
it adds to the stress of a healthcare worker.
Yeah, I'm almost out of time. My producer is saying in my ear, "Wrap." I do want to ask you this question. Um, what is the government getting right, in your opinion? What are they getting wrong, or better yet, what do you want to see improved, changed, tweaked?
I think the government is getting right. Definitely, the communication, the need to communicate, the need to actually be very responsive, and I think that comparatively, they've done a better job than others to close the borders, to take the bold decisions. However, those mean nothing if there isn't enough collaboration, and even if there's not a follow through. So execution matters significantly in controlling the spread, and I think that's where the biggest challenge will be, because no government can do this alone. It'll
Yeah.
require partnership with the business community, with the local communities, private hospitals like myself, and also external companies, external governments. I think this is the time that everyone needs to look at Africa and really see that if Africa succeeds, everyone succeeds. But if Africa fails, the issues that you see around the world are just going to continue for a longer period of time, because Africans are, well, very significant.
Yes, yes, that's an understatement. Yes, we are. Dr. Eliken Tamakloe, Managing Director of Nahu Medical Center. Thank you so much for spending time with me. I really appreciate the insight. It was
All right.
invaluable. Thank you.
Thank you.
Dr. Tamaklo saying something that I totally agree with, that the numbers in Africa are just vastly understated. You don't have to be an epidemiologist to know that, because we know that they're not testing enough. Then that's something to do with capacity. That's also because of specific WHO guidelines, which state, basically 3 stipulations: test those who are obviously sick, those who have come into contact with sick people, those who came from countries with significant numbers of coronavirus cases. But we just don't have a full handle on this situation. I mean, I was talking about urban rural divides or spreads. We spend a lot of time talking about these urban areas, but what about the rural areas? If you have a situation where some 2 million people are leaving, I think he said Accra, by the nighttime, if the numbers are shifting, that's a lot of people going out to different areas, different places, potentially taking this virus with them. To bring you up to speed with the latest numbers as being reported by the BBC, and they are also using Johns Hopkins as their source. But if you go to their Africa tracker, they have all of it collated onto one page. If you go to Johns Hopkins, you have to go to each country, and it can get quite complicated. But the BBC right now are reporting that 6,183 confirmed cases are in Africa. 6,183, that's the number currently being reported. 221 deaths is what they're saying. I want you to remember, I keep giving us like this timeline that when we started the show, when I started my very first show hanging out with you last Thursday, I gave you a number of about over 2,000. I think it was about 2,700 when we went to air. Today is Wednesday. The number as reported by the BBC right now, and they're using Johns Hopkins as well, 6,183 cases in Africa. And we still think that number is underreported between the lag in getting the results and sharing that information, and just in terms of the number of tests that are being done on the continent. Let's see if you've written in, if you've got some more comments to share. Let's see. Didi Aponsem, I totally agree. Africa is underreporting. Didi, again, I keep saying that over and over again. I'm with you. Sesay, underreporting. People saying that, getting this one from Andrea Kirsten, great interview. Thank you. I appreciate that. Agewa rocks. Execution is totally essential in Africa. That was the point that Eliken was making, Dr. Tamakloe, that we need to see better execution and we need to see partnership. I said right at the top of the show that community is everything here. Community in the sense of our own, residential communities, our neighborhood communities in terms of the international community, regional community. This is a time we have to work together. So that is absolutely important. Lots of people joining the show as we do this. Thank you for joining and spending time with me at home. Kadi Mansoure, full disclosure, she's my cousin, just said, very brave to be working during the pandemic. I couldn't agree more. Spare a thought for our doctors and nurses in Africa right now who are working in many places with limited resources, but they continue to go to work every single day, not knowing what they may encounter, in many cases without the PPE that they desperately need, the personal protective equipment. So let's keep them in our thoughts and prayers. The doctors in Africa, the doctors everywhere. Let's just pray for humanity right now. But special shout out to the doctors and nurses, all healthcare providers, anyone working in a medical setting right now, be you a porter, be you a security guard, anyone that is going to those areas where people are sick, carrying a highly contagious disease. We thank you. We thank you for the work you do every single day. More messages being sent. A lot of people tuning in. This one from Kinsray: Can African leaders lead on the solution to this virus? Certainly, there's this question of Africans being certainly just as important as any other part of the world in finding a solution to this crisis and finding a solution that works for Africa. So I think African innovators, African leaders, absolutely, we all can teach the world something, because certainly in Africa, our leaders moved faster to close borders and restrict movements. They move faster than many countries in the West. I think that's just a fact. They moved faster and they moved decisively. Now, just because you close borders isn't the end of the story. You close borders, but then they're still testing. There's still a question of contact tracing. There's still a question of isolation. There's still a question of equipment. So, there's a lot more to do beyond closing borders. But yeah, I do think African leaders did show the world something in terms of, taking decisive action and closing borders and restricting air travel and the like. Thank you for your messages. We'll try and get to some more before the show is over. But I do want to share with you some news of just the toll this disease is taking. I just said to you, according to the BBC site, again, using John Hopkins, they're saying 221 confirmed deaths. And on the show, we want to acknowledge as many of those people who lose their lives to this virus as we can. Because, as I said yesterday, each person, leaves behind people who are grieving. They leave behind loved ones, and they've left a hole in the lives of all those who knew them. And I think it's important that we acknowledge them because everybody matters. I want to start by telling you about the sad passing of Pape Diouf. Football fans will know him as a former president of the French football club Marseille. He died after contracting the COVID-19 virus. He passed away in Senegal on Tuesday. Marseille posted this: Pape will forever remain in the hearts of Marseille people and one of the greatest architects of the club. In a statement, the French Soccer League said this: his death was a moment of immense sadness for French soccer. Pape Diouf was 68 years old, and he lost his life to COVID-19. Another death to tell you about, somebody else who we shall mourn, and is a great loss also. We also lost one of South Africa's top HIV scientists, Dr. Gita Ramji. She died from COVID-19 on Tuesday in Durban. Her colleague said that she was dedicated to using all of her skills to preventing the spread of HIV and looking for solutions for women. Again, they've also said, her colleagues, her death is a huge loss when the world needed her most. Deputy President David Mazuba said this: he called for South Africa to work to flatten the curve and strengthen the response to the global pandemic. We are sending love and prayers and thoughts to the families of these two and the families of everyone who has lost the fight with COVID-19. We try and end every show with hope, because we believe hope is critical. Hope is critical to our survival. I believe hope is critical, and we need it now more than ever. So we have the segment, if you're joining me for the first time, called The Bright Side. And it's, really, having that conversation about where people are finding joy in this moment, where they're taking inspiration. And today I'm so pleased to welcome someone who's bringing a little swag to the show, but it's a specific type of swag. It's Congo swag. Comedian Eddie K joins me now. Eddie, can you hear me?
I can hear you. Can you hear me?
I can. If I wasn't able to hear you from London, I would have been really, really appalled.
Oh, let me tell you something. Some people are going through some stuff in London, so you might not be able to hear some of them.
Okay, so what's going on where you are? Tell me. How are you holding up?
You know what? I'm glad you've asked me what's going on where you are and how are you holding up, because I'm sick and tired of those questions. That's what's your plans for today? I have no plans. I'm at home. You understand? Like, this is the issue. Like, people are asking questions that they would normally ask on an everyday basis, and they're just being ignorant. You're not helping me by asking me, what's on your bucket list for Sunday? Is it Sunday? When is it? Is it Sunday? Because I believe all the days are now united. I can make Tuesday Monday if I want. So I'm glad you've asked me. I'm at home. I've been at home for over a week now. I'm used to traveling a lot, so this is a little bit difficult. But I believe it's an opportunity for me to do things I wouldn't normally do, like visit my kitchen, stuff like that.
Visit your kitchen. Have you showered today? Because I think that's the question you should start with people these days who are in lockdown. Did you shower today? When did you last change your pajamas?
Listen,
that's the question that you should be asking people now in lockdown. Don't ask me, though. I ask questions here.
I'm not answering any of those questions because I don't have to, because you have no proof. You don't even have proof if I brush my teeth right now. I'm telling you. But let me tell you something. See, me, I'm an
Too much
African boy.
truth, too much realness.
I'm an African boy. So because of my upbringing, no matter where you are, once you get up, you must tidy your room. You must go straight to the bathroom. You must wash. You must brush your teeth, regardless of corona, no corona. What I've been concerned about is a lot of people have been exposed. There's many people have been exposed during these hard times. Yes, those people who do not even know they had a bathroom. Suddenly are like, oh my God, I have a bathroom. I must make use of it. All those people that were rushing for toilet rolls, you didn't know you could use toilet rolls before. Washing your hands is supposed to be like breathing, like blinking. What's going on? I've been really concerned about people. Been really concerned.
You're concerned about humanity.
I am.
Where
I'm very,
are
very
you
concerned.
where are you deriving hope? Where are you drawing hope, inspiration from, so that you can remain so upbeat in this moment? Talk to me about how you're holding it together.
Family, I think it's extremely important. We do neglect our families. We definitely do neglect our friends. The what we call basic stuff in life are actually the most important, the most essential. Oh, mom, I'll call you back. I'm just